Well, September is Pain Awareness Month for pets and people alike. Dr. Kelly Gebhardt is joining us to answer your questions about the signs and symptoms to look out for when it comes to your furry friends. So to get your questions answered by our expert today, you need to text us 336-379-5775. Remember, this is text only, so please don't call. All right, so since it is Pain Awareness Month, let's first talk about the difference between acute pain and chronic pain.
Yeah, thanks so much for having me. So acute pain, when you think about pain in pets, think about it just as you would for yourself. So acute pain is a sudden pain where you can't walk, you cry out in pain. For your pets, same thing. Not being able to walk on a limb or limping, crying, trying to bite when you touch them, not wanting you to touch them in a certain place. Chronic pain is more like when they're slowing down, not being as active, maybe sleeping in different places, licking a lot at one spot, which can indicate arthritic pain, decreased appetite, change in behavior or attitude or interaction with you. They may be more clingy or more reclusive. These things are all possible indicators of pain.
Okay.
Also, not wanting to go up or down steps.
All right, well, hold on right there. We want to make sure that we get it right. So acute is the instantaneous, oh my gosh, I'm in pain. The chronic is this is lasting for a little bit. And let's go over the acute signs and symptoms first so that people know exactly what you're talking about.
Yeah, so sudden limping, suddenly crying out, not wanting you to touch them in a certain spot all of a sudden, trying to bite. Those are, sometimes some people say, my dog jumped off the couch and suddenly won't walk, is crying out in pain. My dog was fine this morning, but now won't walk up the steps. These are signs of possible acute pain.
Okay, and so then the chronic pain is stuff that probably all of us kind of live with, right? And maybe our pets are living with it too, and maybe we don't even realize that they're living with this chronic pain. So what are the signs and symptoms of the chronic pain?
Absolutely. So chronic pain is change in appetite, lack of like a decrease in activity, trouble getting up or laying down, or if they've been sitting for a while, they have trouble getting up. Limping is also a sign of chronic pain if they're doing it all the time or changing their gait. They may be licking a certain area of their body a lot, which can indicate an underlying arthritic pain. Also, they may be more clingy or more reclusive, maybe spending more time alone. Those are some signs of chronic pain.
All right, so either one, is it something like we as pet parents, do we react immediately when those things are happening? When do we know that we need to go and see you and have you do an exam?
Absolutely. So acute pain, you're going to know right away, whoa, my dog or my cat's in pain. I need to get him to a vet, right? If it's transient, they cry out once, they limp a little bit, then they get better, it goes away. You may not need veterinary care. But if the signs of pain continue, you need to seek veterinary care for acute pain, meaning not walking or limping on a leg. A lot of people think my dog is not crying out, but they're limping, they must not be in pain. If they are limping, walking differently, not weight bearing, not jumping onto furniture, going up or down steps, those are indications you have to see a vet because they're in pain.
Okay, and so then how does a vet identify pain? Because I think people always, they're a little bit, their emotions are going, but then they're also looking at their pocketbook and they're going, are these things necessary to identify pain?
Yeah, so the first thing is doing a really good exam, right? So a lot of times we can localize the pain based on the exam. Sometimes cats or dogs won't actually tell us what's hurting, but we can go based on the history and the exam. And depending on what those two things tell us, we may say, let's do some blood work to look at systemic health, urinalysis to see if there's urinary tract pain, x-rays to look for underlying arthritic pain or a disc issue, just like people. Dogs will get herniating discs. It's a common cause of pain. We'll do x-rays to assess that. So those things are all very important. However, first, the most important, start with an exam and go from there. An exam and pain relief can be really important. And then getting to the bottom of it through some blood work and x-rays and urinalysis are the next steps to help really hone in on where that source of pain is.
Gotcha.
And what's causing it.
And when we're talking about making the pain go away or helping it, there are options for our animals that are just like for us, like acupuncture and things like that.
Oh, so many options, both pharmaceutical and non-pharmaceutical. So first, people think of pain relief medications, opioid or non-steroidal anti-inflammatories, and there are a variety of other medications that can also provide pain relief. but there are lots of non-pharmaceutical options which are also beneficial to use by themselves or in conjunction with pharmaceuticals. So you have fish oils, turmeric, physical therapy, massage, laser therapy. We have a class 4 laser at Happy Tales that we use for acute and chronic pain, surgical procedures, ear infections, snake bites. We use this laser for so many things. I use it on myself. It's fantastic.
Okay.
There's also acupuncture and these newer items out called PMF, which are electromagnetic frequency devices, which you can put over a source of pain. A lot of people find them very beneficial.
Great. Okay. So what we're going to do next is we're going to continue taking your questions. We've got everything from when certain vets, where certain animals should be fixed or not, and things of that nature. We're going to be taking your text questions coming up right after the break.